Right. So good afternoon, everyone. Welcome to the April UN Info session. My name is Linda Buzaher, and I am a member and volunteer with the San Diego chapter of the United Nations Association. For those of you who might not already know, the San Diego chapter of the United Nations Association was established in 1946 and basically just works to promote engagement with the United Nations by translating global initiatives into a more local context through education, advocacy, outreach, and other actions supporting the advancement of the UN 2030 Sustainable Development Goals. You can learn more about these programs and what we do in relation to sustainable development on our website, unasd.org. And there you can also view our previous UN Info sessions or watch them on our YouTube channel. In today's UN Info session, we are honoring and celebrating both World Health Day, which took place on April 7th, and Earth Day coming up on April 22nd. So the objective of today's panel discussion is to really generate some conversation around the importance of environmental health, and specifically in our local San Diego area, but to also touch on public health and try and draw some connections between the relationship between our community and our environment. Today, I am very happy to introduce our three panel speakers. Ms. Shawn Fettel, a current education program specialist representing I Love a Clean San Diego. Mr. Duncan McFetridge, Executive Director at the Cleveland National Forest Foundation, and Ms. Adama Dionysiak, Executive Director of Champions for Health here in San Diego. Links to all three of their organizations' websites and social media platforms will be provided in the description of today's meeting, so please follow their work and stay connected from here on out. So with that being said, I'd like to jump into the questions and begin with Ms. Shawn Fettel. Shawn, are you able to tell me a little bit about your organization, I Love a Clean San Diego, and kind of the current work that you do in the San Diego area?
Absolutely. So thank you so much for letting us join you today. So first off, I work for I Love a Clean San Diego, and we've been around since 1954. We work with communities and volunteers throughout San Diego County. We do beach as well as inland cleanups, recycling referrals, and also my very favorite part is educational presentations throughout San Diego. And as I mentioned, we've been around for more than 70 years. And we started out as the War Against Litter Committee, and somehow that just doesn't have a great name to it. So we adopted the slogan, I Love a Clean San Diego, which became our name. And what we try to do is we try to encourage everyone to take care of their environment, and we work to create a lasting and positive impact on our region and help to beautify San Diego County and hopefully reduce waste.
Thank you very much, Shawn, and welcome.
Thank you.
Duncan, would you like to talk about your work at the Cleveland National Forest Foundation and some of the work that's being conducted in light of sustainable development?
Yes, thank you. It is an honor and a privilege here to be on your program, Linda. It is, I consider it, all these subjects that are here being represented, the most important subjects on Earth. And from our beginning with the forest, it became related to your work, Linda. And we like this motto, for example, act local, think global. And I think that's a very, very important philosophical model for discussing local affairs. And that comes up dramatically with our environment, especially the forest, because of the incredible diversity here in Southern California. It matches world diversity. And the other thing we would emphasize, the other comparison that's going to involve cleanliness and health is that the global danger is reflected with the local danger. Therefore, the solutions that are being proposed in Paris, for example, or that world leaders, biologists are proposing, we say those are also applicable to the local situation. And I don't want to take too much time at my introduction, but I did want to ask if all the participants could think about making the right analogy in our conversation and the right comparisons between this local and global. So that's my little, anyway, here's what, local politics was going to destroy the forest. I mean that literally, for wrong reasons, right? And the people saved it. We had a people's initiative. So that's where our work began. The people saved the forest, and we've moved on to city politics.
Great. Thank you so much, Duncan. And then lastly, Adama, please introduce yourself and your organization and tell us a little bit more about some of the work that you do for the community.
Great, thank you. Yes, my name is Adama Dionysiak. I'm the executive director at Champions for Health. We started as a association for medical and paramedical education and research, founded by the San Diego County Medical Society in 1968. In 2004, we were renamed the Foundation of the Medical Society, and we were founded to address the needs of medically underserved in San Diego County. In 2014, we renamed ourselves as Champions for Health because, again, it rolls off the tongue better and it makes more sense as to what we are doing. And we're dedicated to providing access to critically needed healthcare for uninsured low-income residents of San Diego County who would otherwise face insurmountable barriers to care. We recruit, mobilize, and support hundreds of volunteer physicians and other healthcare professionals to provide free, preventive, and specialty healthcare services. And from the standpoint of what Duncan and Sean have been saying, the environment and everything around us is one of the social determinants of health. So what we do to the environment, we're doing to ourselves. And as can be evidenced over the past year of the COVID pandemic and how for the majority of the world was shut in, some at the same time, some at various times. Did we see pictures on Facebook and so other social media platforms where pollution around the most polluted cities in the world was gone? It was actually clear skies. Animals were out and about frolicking and happy to be alive. Plants were growing that otherwise would have been cut back within inches of existence. So, like you said, think global, act local. If the pandemic isn't an indication of that, I don't know what is. And everything is linked together. So thank you for having us. We're happy to be part of this conversation.
Thank you all so much. Definitely an important conversation, and I'm very excited to get into some more specifics. So welcome to all three of you. And again, thank you. Sean, I'll start with you again, just for the interest of time with I Love a Clean San Diego. I just wanted to ask you, in light of, the specific work that you do with the organization, can you maybe just talk about some of the biggest trends or the issues that you're seeing with regards to environmental health, or any of the impacts that you've seen locally?
Absolutely. So we work with thousands of people all over San Diego County to improve the environment. And I can talk a little bit about 2019's accomplishments, and I'll explain why I'm focusing on that year. Is that unfortunately 2020, as we all know, was a little bit of an anomaly. So let me kind of give you a highlight on 2019, and then I'll talk a little bit about 2020 and 21. So we worked with roughly about 35,000 volunteers and educated about 45,000 youth and adults, and collected about 350,000 pounds of debris. Think about that, 350,000 pounds of debris. In addition to that, we have stenciling awareness messages, over 1,000 storm drains, and handle roughly about 20,000 recycling inquiries. Now, I point that out because, of course, in 2020, as Adame was saying, is that things changed quite a bit. And what we now are seeing was our number one debris item on all of our cleanups has always been and continues to be cigarette butts. Unfortunately, in 2020, we picked up over almost 45,000 cigarette butts, just cigarette butts. But unfortunately, what's now made the top 10 list are PPE. So the top 10, hitting number 10 is gloves and masks, at almost 3,000 of them being picked up. So there are some benefits to the pandemic. What we saw was dolphins we're going global now, dolphins in the Venice canals in Venice, Italy. We saw clear air in China for the first time in I can't remember when. And so we know that if we make the right choices, we can actually return the world back to its natural state. So that's one of the things and goals that I want to go for. I believe it's a balance. I don't believe we need to go back to the Stone Age where we don't use anything. But I do think that there's a nice balance, and we can attain that balance by making sure that we make the right choices. And with those choices are everyday small actions. If you see trash on the street, instead of just walking by and saying, wow, there's trash on the street, pick it up and throw it away properly. Now, most people say, well, I don't want to touch it. I get that. What I do is I'll take bread bags, bagel bags, anything I normally would have thrown away, and I put them by the front door. When I take a walk with my friends, I put them in my pocket. And then when I take that walk, you can put your hand in it, grab the trash, and throw it away properly. So there's ways around it. The other thing I love to do is take walks around the bay with a bucket and a picker. And as I'm walking, just pick up trash. The last time I did that, it was roughly a 40-minute walk, and I picked up over 50 of the juice box, you know, the sleeve that goes with the straw, 50 of those sleeves. So just being aware of your own things that you end up dropping, could be on accident, could be on purpose, as well as just picking up in your environment. So just being aware of those things: food wrappers, bottle caps, beverage bottles, metal bottle tops, straws, stirrers, all of those things all add up. Sadly, scientists have actually found in the deepest parts of the ocean, the Marianas Trench, which is roughly about 7 miles down, they've actually found plastics there. So all I share with people is, if you have a choice between metal and glass and plastic, choose the things that can be renewed and recycled over and over and over again. We as a society have been recycling glass since 1000 AD in Alexandria, Egypt. We can continue to do that over and over again. Plastic and paper cannot be recycled over and over again. So just again, small everyday choices can have a huge impact.
Thank you so much, Sean. I really appreciate how you mentioned kind of balancing, educating others and then promoting awareness of things that can be recycled in the area, because I think it's very important that people know what to recycle and how to recycle it. So thank you. Duncan, would you like to discuss some of the largest trends or the issues that you've been seeing in terms of the Cleveland National Forest Foundation and your environment?
Oh, yes, I would. I took a deep breath because it's monumental. I have to condense my comments here. Well, back to Sean's point about a choice makes a difference. We in the forest problem and urbanization of our wildlands or sprawl, the choice here is the choice of public agencies that we focused on, and therefore, if we get back to our global analogy, and all the meetings, Paris Accords on what the choices are facing the global environment, that becomes a state, a city decision. For example, to sprawl. That is a public agency choice. Now, therefore, one of the analogies we focus on in terms of impacts and dangers is to use the Titanic. as an analogy to our problems, our global problems. So how is this Titanic being steered in light of all the dangers it's facing? So back to the forest then, is what we innocently discovered living up here is they wanted to sprawl and build homes in a national forest. And it literally took a people's initiative, back to choice, Sean, a people's initiative to overcome all the combined agencies, city, county, Sandag, Caltrans, and we've sued them all, by the way, later on. So we definitely have a public agency problem here of monumental proportions. So that's why I like to keep referencing the global danger. For example, all the scientists say that currently we're facing an extinction crisis. And that is also true locally. But what is the solution for the extinction crisis globally? Well, the most famous biologist of all, Wilson, said 1/2 of the earth and the oceans must be set aside. Now think of that statement. 1/2 of the land and ocean should be set aside for our salvation. You could not get a more dangerous statement of our condition. The problem, therefore, you see here locally, and I think is very, very important what I'm going to say right now, carbon is not the problem. Political decision-making is the problem. And so who's steering the ship, Linda and Sean and Adama? Who is steering the ship? And what is the North Star here by which we steer the ship, you see? I just can't emphasize enough how serious this program is in terms of the dangers that we face locally, globally, right? And the right decision now. All the scientists are saying we're in imminent danger right now. We're facing an extinction crisis worldwide. So I don't want to keep going on here, except I would really say, and I think what I'm saying is corroborated by Sean and Adama, is that when we tackle this problem locally, for this incredible biodiversity that's in San Diego County, it was philosophical. Does urbanization measure the forest, or does the forest measure urbanization? Does the artificial measure the real? Does the real measure the artificial? We have things exactly upside down, like all the great thinkers said. So we need to, turn things right side up and make our decisions based on ecology, ecological health, or this ship is going to sink locally and globally. And that's what everyone is saying. Therefore, let me end right now by saying, you see, I can confirm, because of all our lawsuits, our work statewide, locally, we sued them all. We won all our lawsuits, by the way. It didn't make any difference because the same people are still in charge. We have a political, philosophical problem, not an environmental problem.
Thank you,
Okay,
Dr.
I'll stop there for now.
I appreciate your emphasis on regulation and how kind of politics plays a large role in monitoring all of these issues. So thank you so much. Adama, over to you. In light of public health, are there any trends, issues, challenges that you're facing with your organization?
Well, I wanted to kind of wrap this all together. What I was hearing, it reminded me of a story, and people may know this story. It's kind of an old one that it says, a little boy's walking along the seashore and all these starfish are stranded on the shore, and he walks up to one starfish and throws it in the water and keeps walking, walks up into to another one, throws it in the water. And someone who's observing him says, well, you're not going to be able to make a difference for all these starfish. And the little boy picks up a starfish and says, well, but I made a difference for this one. And he throws it into the water. And so, what I like to think of from all of this is everyone can make a difference to at least one person. When you shine a light, you don't just shine it on yourself, you shine it on whoever is in your direct sphere. And so everything that has been going on with the pandemic, we do, for example, COVID vaccinations. We're in full gear doing that right now. And we don't just do them anywhere. We don't do the huge pods. We go to the Healthy Place Index zip codes, which is in the locations where there's the greatest health disparities, the greatest health inequities, to try to level the playing field, to go to locations where folks are very poor, more than likely uninsured, in their parks, in their community centers, in their churches, in their synagogues, in their low-income residences. The first people we did was folks over 65. And then everyone, now it's opening up to everybody, right? And so the way to build equity, whether it's social or health or racial or economic, is to make the choice to help people where they are in that situation, and then do it like a bullseye. So you start in one area, you help that person, you help that family, you help that building, that block, that neighborhood, that community. And that is what we're doing, despite the challenges of how things are. I think the greatest challenges currently, other than trying to equalize health equity, right, inequities by creating equity, is working with our partners. We have so many hundreds of community partners that we work with, that they know, we know what we do best. They know what they do best. They work within their community with the people where they've gained trust and rapport. We're really good at logistics and galvanizing all of our volunteers, our hundreds upon thousands of volunteers that are either nursing students in nursing associations, the doctors of the medical society, the pharmacists of UCSD pharmacy school, whoever it may be. We mobilize these folks to go out and provide the services for free to the communities that need them. And so we're all working together towards a common goal. So now you've seen over the past year, and especially now with our new federal administration in place, there's a lot of funds coming through. But the other thing that was glaringly apparent when the COVID pandemic hit here in the United States, and for sure in San Diego, is that public health funding has been inadequate and being cut for decades. And now, when we needed to have a public health workforce to go out and do what needed to be done, instead of having the funding to do it, everyone was doing it based on volunteers and doing what they could within their organizations or within their health systems or hospitals or clinics or whatever organizations they were in. The part that was wonderful for us at Champions for Health is everyone was calling us. We were calling everyone. What are you doing? Can we do it with you? The need to, we've got to do something. What are you doing? We're doing this. I want to be part of that. We want to be a part of that. And we found that all of this helped to get us to the point where we are now. Just in 15 weeks, we've given out over 10,000 doses at 150 sites. Some sites might have been 10 people in a nursing home. Some sites were 500 people at Chicano Park, and everybody in between. So, we are out there going where No one's gone before. I don't know about that, but we're going to the places where people need to be to provide the help. And I wanted to maybe provide beyond COVID the idea that health inequities and economic inequities can lead to environmental health and vice versa issues. There were several pieces of information, such as 220,000 people remain uninsured in San Diego, and that was before the pandemic. Imagine now. There was a Healthy People report that showed from San Diego County in July 2018 that the central and southern region where most people of color live had lower rates of having a primary care provider, receiving screenings, controlling various chronic conditions. And the pandemic exacerbated economic and racial disparities based on race, according to a Sandag report out of that came out in June 2020. Black and Hispanic populations are 4 times as likely to live in areas that have been impacted by COVID-19 and unemployment. So all of that together then leads, so that's your environment, right? The health of you and your family and your community, and the economics of you, your family, and your community. So when that occurs, the environment will suffer as well. And so your health, like your respiratory health, there were higher rates of asthma and other respiratory illnesses that will, occur in areas where health inequities exist. And so, what do you do? In the past year, luckily, we were able to wear masks, though they are an issue in their own right, having to do with debris. But that decreased how much flu there was, how many allergies people had, COVID transmission. I mean, all of that. And then at the same time, all this pollution went down. So actually, respiratory illnesses were not as bad. I mean, my husband gets sick 2-3 times a year from a cold, not once. People that I knew that normally get sick all the time, they were fine, having to do just with respiratory illnesses. And so part of what we do is we work with community workers and people that are close to the situation and understand the situation much better than we do. They're doing their best practices and what they're wonderful at in their community. We do our best practices. And I think putting that together, having an integrated approach for any situation, can only help in making that situation better.
Thank you, Adama. I will pause you there just because I know Sean actually has to leave early. So I'll just ask you, Sean, and kind of just giving us some concluding remarks. We heard Adama talk about kind of the collectivism that we need and the awareness. And then, Duncan just talking about, the influence of policymakers and regulations. What do you think of sustainability in San Diego and, in the future of sustainability? What are some things that come to mind, and what kind of, changes do you wish to see in your San Diego community, and how do we get there?
Oh, that's a big question, and we don't have a ton of time, but let me kind of tell you a little bit about legislation, because both Adama and Duncan both mentioned that there are some positive things that have been happening as far as legislation goes. SB 1383, which is the short-lived climate pollutants legislation that was signed in 2016. It was basically a statewide reduction of organic waste. Sadly, roughly about 40% of the food that is grown in the United States is thrown away. So literally, to be like going to the grocery store, grabbing 2 bags of groceries, you walk in the door and you take one and just throw it in the trash. And you might think, well, that wouldn't happen in my house. But what happens is say berries get shoved into the back of the refrigerator, and you realize, after a week, and you toss those. So the idea is, legislation is wonderful, and I strongly encourage it, but we cannot have a personal connection to that legislation. What we can have a personal connection to is our own individual actions. And so the things that we can do is be conscious about what you purchase and then what you throw away. And instead of, we've kind of developed into this society in the last roughly 50 years of buy bigger, better, etc. Think about all the supersizing things. And that goes to the health issues as well, Adama, making sure that you've got a supersized meal when you don't need a supersized meal. And unfortunately, we've kind of gotten into that mindset of bigger and more. And if I can afford it, I want a bigger fill in the blank. You don't need it. So kind of reducing back down to a different mindset, taking into consideration the hierarchy of what you need, what you can control, things like that, reducing, reusing, and recycling. Those are huge. But ever since I was a kid, those 3 R's, we've always focused on the recycling. We really need to start refocusing on the reducing, the reuse, basically rethinking, changing our daily habits, buying less, storing properly, switching to reusable items like grocery bags and produce bags, reusable water bottles, reusable utensils. Back to the straws. Do we really need them? The only time I can think of you probably would need a straw is either if you're sick or you're driving. Beyond that, do you really need a straw? So again, instead of just saying, oh, I'm just going to grab this straw because it's there, start rethinking, do I really need this? And changing our own personal life habits. I think all of those things will help a lot. I believe it was Calvin Coolidge in 1917 said, let me see if I get it correct, use it up, wear it out. Oh shoot, I can't remember it right off the top of my head, but it's basically doing without unless you absolutely need it. So that's kind of the goal. This weekend, we have a huge event coming up. It's called Creek to Bay, because what most people think of is when they think about pollution in the ocean, they think about, well, I don't live near the beach. I live far away. I live in the mountains. It's not going to affect anything that's going on in the ocean. But in reality, every single person can have a positive effect on every part of the ocean, every part of the planet. So if you drop trash in the mountains because of going through creeks, estuaries, and streams, it'll go out into our San Diego Bay and out into the ocean. So we all have a responsibility. And one of the things you can do is to register for Creek to Bay this weekend. We have a goal, it's a lofty one, of if we can all collectively come together and pick up trash. The idea is that we're going to shoot for 30,000 pounds of trash in one day. And we can only do it if we all come together. Because if you think of it, there's 4 of us here. If we all collect 5 pounds, well, that's closer to our goal. So what I would suggest is go to cleansd.org to the events, to Creek to Bay, and register there. And again, all we can do is be responsible for ourselves and our own actions, be mindful of how we respect our planet, how we respect others, and that's going to go a long way to changing our future. And I want to thank you so much for letting me come. I do apologize. I do have to teach in a few minutes. So thank you very much, and I hope you guys have a great rest of your day.
Thank
Nice
you
to meet you,
so
Sean.
much, Sean. It was a pleasure having you, and we will be sure to list your information at the end of this meeting for your organization. Thank you so much for your time.
Thank you so much. Have a great day. Bye-bye.
Okay, so with that being said, I want to change the direction a little bit in terms of, Champions for Health and then Cleveland National Forest Foundation. So Duncan, I want to start by asking you, the population is projected to increase a significant amount. I think, in between just 2004 and 2030, they projected growth of upwards of 1 million people. What do you see are some of the biggest risks in terms of a growing population, especially in considering frequency of wildfires, fire incidents that are all in direct proportion to the human population? How is human activity kind of influencing land use and agriculture across the forested area?
Very good question, Linda. Excellent question. We have focused on this, as a matter of fact, as the essence of saving the environment in the forest, and that is good city building. So, a very short answer to your question about population, back to the Titanic example. What's more important is the state of the ship and its navigation than the number of people on the boat. Let me clarify that. We have approximately 700 square miles of urban city area in the 5,000 square mile county. I'll repeat that, 700 square miles. We have hired all the experts, done all the studies. There's more than enough land to house that new population, Linda, if we had the right infrastructure. And that gets me back to my little Titanic analogy. So the population is not the problem. The infrastructure is the problem. We do not need to sprawl. And back to Adama's health concerns, we have also studied this. There is a direct relationship between transit, bike, and walk and the health of a city. We have studied cities in Asia and Europe and Canada, and the findings are dramatic. San Diego, I mean, some of these things I'm saying nobody knows, and they need to be known and shared. They're on our website. For example, back to health, Adama. San Diego, out of 100 of the metropolitan areas in in America, ranks 94th at the bottom in the climate index. Can you imagine what that means to individual health? Pollution. There's our transit, bike, and walk mode share is the same as Houston. That has no zoning at all. So, frankly, our city building is a scandal, and I mean a scandal. And that is why we focus here on the collective and agency responsibility. And I'll have to add again, our record is very clear. We've had 3 attorney generals enter our lawsuits, for example. And these are monumental, affairs. So I keep getting back to the fact that our real core problem is good city building. And back to the economics here too. With very poor transit, bike, and walk, the economic burdens on poor people, working class people, are enormous. And precisely a lot of poorer class, working class areas are where the freeways are, and they're most polluted with all the health effects. See, Adama is shaking her head there. We've studied that. It is absolutely unjust to have this situation that could be solved. You see, it's a political problem here, transit, bike, and walk. To make that mobility competitive with the automobile. It's automobile and sprawl that is destroying our environment, our health, and is also contributing to that huge trash pile that Sean was talking about. So is that, am I covering your answer here?
Yes, that's great, Duncan. And to some of the points that you made, I actually want to direct my next question at Adama, because with a steady growing population, statistics show that almost a quarter of the region's residents by 2050 will be age 65 and older, and half of those people will be over the age of 40. So I wanted to ask you, in terms of such a vulnerable population and kind of the linkages to public health impacts of climate change, what do you see as some of the biggest risks, and how do you think your organization is going to kind of help contribute to some of the forecasted impacts, Adama?
Well, I think one of the things I'm pretty proud of is to be connected with the County of San Diego Health and Human Service Agency, because Nick Macchione and his staff at various levels has put together Live Well San Diego, which is trying to impact and has been for over a decade now, if not longer, health inequities in all of its forms. And everything that you said having to do with the aging population, which didn't just happen to start now, but it is, in 2000, every year, millions of people have been added to that are turning 65 and older, 85 and older, and then so forth. And so what is needed is for a couple of different things. I don't think it can be one solution. It needs to be multiple solutions working in tandem, and integrating the way that they implement or operationalize anything that they want to get done. So it needs to be at the county-wide level, whether it's health systems, hospitals, federally qualified health centers, small medical offices, and all of the nonprofits that deal with health, and just communities in general on all the different kinds of services that they provide to folks who are most vulnerable, whether it's folks who are getting on in years and all the non-communicable chronic diseases that continue from that point forward, as well as any communicable diseases that can occur in that age bracket and as you pass through from one phase to another. All of those working in tandem. And I can tell you that there are numerous collaboratives in all different parts of San Diego County, North, East, South, Central, that are working diligently on addressing the most prioritized issues of that area, so that those who are most vulnerable, including the aging population, can have those addressed. And then when you look at communities, it is with pride that I can tell you that we have worked with, for example, the San Diego Black Nurses Association, the Hispanic Nurses Association, the Filipino Nurses Association, that we have worked with them in their communities. And we have heard with faith-based organizations to, for example, decreasing cardiac disparities, just the simple getting your blood pressure checked and knowing what your numbers are and what you can do to maintain the numbers and keep them at a level that is appropriate, whether it's through behavioral change or family changes or community changes, and working with them. And I mean, it just is, it touches my heart when I have heard volunteers tell us, this is a historic moment. I am so proud to, for example, this is a quote, I am so proud to be working in my community, which is of a lower socioeconomic background, and to help people of my community so that they can be healthier, so that they can get vaccinated, so that they can prevent some very bad outcomes from happening just through, getting vaccinated, whether it's for the flu or for COVID or for anything else. And then there's on the personal level, to know that, I don't have to do 10 things to change something, but what one thing could I do? What 2 things could I do? I could drink more water. Why don't I start doing that? I could take a walk outside and around my block. I can do that. I can take my friend with me. I can take my older elder who lives next door with me, see how they check in on them. Do what people used to do all the time. I'm from back east. I grew up in New Jersey, and everyone would always sit out on their porches, on their doorsteps, and take care of each other. Hey, if your mama saw you doing that, they'd be upset. You know better than that, whatever it is. It's like, oh, come here, let me wipe your face. Or, oh, you have a boo-boo, let me put a Band-Aid on you. Everyone took care of one another. And so to just go back to that, what are the personal choices that I could be making, that each person could be making, that will help my health, will help the health of my family, my community, my environment, which is my community, and then San Diego County overall, and then of course beyond that. And usually if a person takes at least small steps, it makes them feel better. Like I did it. I was able to do this one thing. when Sean was talking about food waste, you know, that kind of thing really is part of health, because folks are needing to learn how to change their diets, right? So that they eat more healthy. And as you get older, you don't need to eat as much, but you need to eat certain foods. And so I was just on Sunday, I mean, literally just on Sunday, looking at the blueberries going, oh, heck, you know, half of these are too soft. Hey, blueberry sauce on top of the ice cream that I'll be having later. Shoop, shoop, shoop. It got made. It took me just, 5-10 minutes. Nothing was wasted. And I have blueberry sauce. And so it's, thinking what else can be done? This lettuce is wilting. Could it be put on a compost? Could I start my own community garden to clean the air, be out in my community, help my own health? That kind of a thing. So I think that there are multiple things if people just open up their eyes and kind of look around, what could I do to help out, that would really bring the health of themselves and everyone around them just up a little bit every single time. So here at Champions for Health, that's what we're doing. We're working with our community partners. We have a speakers bureau where we provide health presentations by our volunteer physicians and nurses. I mean, for example, what better way to find out about heart health than having a cardiologist talk to you about it, right? We do that. We also have our immunizations and our various screenings that are out in the community. And so I love it when, for example, we went to Mount Hope Community Garden right down in Southeast San Diego. And all the people who have gardens there, little vegetables are growing and everything. So we did COVID vaccinations there. We were providing speakers to speak on various health topics, including COVID vaccine hesitancy. And everyone was talking with one another. How are you? How is everything going on? Oh, I heard this. You should talk to this person over here. Let's get our blood pressure screened there. So it was a real community family feeling, all in one place, all having to do with health. So I'll just end on that I think the way to do this is one person at a time, and everyone knowing what they're best at and helping others who know what they're best at and doing it together towards a common goal. We can't wait on anybody to do it. I think it's grassroots movements are the ones that have done the greatest change. And then eventually legislation comes along and it gets changed, but it's because the folks who put folks in office made changes that made a groundswell and things got better. So that's what I'm hoping for the optimistic that we can all work together towards a common good, and it will result in better climate, better environment, better health overall.
Thank you so much, Adama. That was very, very informative. And I think the moral of the story here is that we need to care and that we have the power to make others become aware. We need to volunteer and we need to participate in our community for those who cannot always for themselves. So that kind of wraps up, the amount of time that we have. Duncan, if maybe you have, any concluding remarks in maybe a minute or less before I kind of go over some of the sustainable development goals in relation to today's interview, I'd love to hear from you on kind of, a way forward.
Okay. One subject critically important that affects all the things we've been talking about is the homelessness and housing crisis. They're connected. And that is a function of this infrastructure deficit of transit, bike, and walk by our studies. It is absolutely unconscionable that a student, with barely making it financially, has to pay $700 for a room in a house. Can you imagine what wage earners, elderly, are faced with the housing shortage and crisis and cost? So those are all related to our subject matter. And back to my beginning point about good city building as the foundation of a good environment, health, and a clean San Diego, and a clean global world.
Thank you so much, Duncan. And just in kind of wrapping things up here, I wanted to thank both of you so much for volunteering to talk about your organization today. I think you've both really provided, meaningful insights into the power of advocacy and awareness and community involvement in helping alleviate some of the local climate related issues, the public health related issues that need to be addressed, so we can really preserve and protect those in our community and those that are part of our natural habitat. So thank you so much for sharing your experience and your expertise. With that, I do have a quick brief that I wanted to share, and I'm going to just quickly share my screen. Okay, so I just wanted to discuss the Sustainable Development Goals, talk about why they are so important, and how viewers at home can take actions to help achieve them locally. So there are 17 total Sustainable Development Goals as part of the 2030 Agenda for Sustainable Development. They were created in 2015 and they are supported by all UN member states. They help essentially call to action and promote various initiatives such as gender equality, ending poverty, and creating sustainable cities and working to protect our climate. So many of the Sustainable Development Goals connect to the missions of all three of the organizations that we had as part of our panel interview today, but I really want to highlight a few that I thought were the most relevant to their mission. With each, I have provided an actionable step that you can take at home to kind of play a part in reaching the Sustainable Development Goals for each of the ones that I will be mentioning. So we'll begin with Sustainable Development Goal number 3, and that's ensure healthy lives and promote well-being for all ages at all ages. So to support this goal, something super small that you can do is just make sure that you or those around you get at least 8 hours of sleep at night. Or you can also make time for yourself or your family to help build stronger, more meaningful relationships. Next, Sustainable Development Goal 10, reduce inequalities. So the effort to reduce inequalities within and among countries. An actionable step that you can take today is to maybe read storybooks to children or family members about different cultures of those other than your own. Sustainable Development Goal 11, sustainable cities and communities. So making cities and human settlements inclusive, safe, resilient, and sustainable. An actionable step that you can take today would be to support the development of free sports and recreational spaces around the community to help build stronger, happier, healthy communities. Sustainable Development Goal 13, taking urgent care to combat climate change and its impact. So one action you can take today is, for example, use reusable bags when you go to the grocery store rather than plastic bags. And then lastly, Sustainable Development Goal 14, conserve and sustainably use oceans, seas, and marine resources for sustainable development. One action you can take today is to use fewer plastic products. So for example, purchasing a reusable water bottle, which as we all know, often ends up in oceans. So with that being said, I would like to thank Duncan, Adama, and Sean for participating in such an important discussion. We encourage our community to join our monthly United Nations info sessions, and we hope that you will follow the 3 organizations that we interviewed today to learn more. Thank you.